The Division of Cardiothoracic Surgery at the University of Alabama at Birmingham originated in the mid-1960s when John Kirkland came from the Mayo Clinic. It has developed and grown over the last 60 plus years. We continue to provide state-of-the-art care to the people in Alabama and to the residents in the Southeast. The Division of Cardiothoracic Surgery has doubled in growth over the last 10 years, and we also now are one of only 5 programs in the country that are STS rated in all 6 categories at a 3-star ranking. So to maintain that quality, high quality structure and grow the volume, how have we done that? It's mostly with having the right people, having the right surgeons, the right team. We have a very extensive intensive care service. We have grown our residency program by almost tenfold in the last 10 years. We provide the full gamut of cardiothoracic surgery that includes full standard open surgery, provides minimally invasive including robotic cardiac surgery, and transcatheter therapies as well. The transcatheter therapies include transcatheter aortic valve replacements, mitral valve therapies, and tricuspid valve therapies.
Patient care being the center of decision making is absolutely critical, and also a pillar of how we do things at UAB. There's so much involved in complex cardiac surgery and aortic surgery. It's often weighing the risks and benefits of continued surveillance versus some sort of complex intervention. And really that is a shared decision with a patient. And so making sure that the patient understands the risks and benefits and understands the risks of the operation are absolutely critical.
When I discovered about 5 years ago that I had a mitral valve problem, I went to see Dr. Jamie Davies, and he assessed my situation and said it was something that could be repaired and that he would be glad to handle that. And so in the process of preparing for that surgery, we also discovered, unbeknownst to me, that I had an aneurysm in my ascending aorta. Dr. Davies was quite reassuring and explained to us that he could repair that at the same time that he worked on the mitral valve. The type of treatment I received was reassuring because it wasn't just me going through this process. Dr. Davies and his team were always willing to explain the process to my wife, who was obviously concerned about this whole procedure. So it was comforting to know that I had such great surgeons, but they weren't just focused on the mechanics of fixing my heart. They were also focused on reassuring me that you're going to get through this. It's something we can handle. Explain the risk. Of course, there's risk involved in everything, but that there would be a recovery. Here's how the process would work, and any follow-up needs, call me at any time. That sort of hands-on care was really impressive.
Not only is the Division of Cardiac Surgery truly such a strong division, but we have collaborative partners in vascular surgery, interventional cardiology, who are also truly world-class. And so when we combine all of those together, we really get the best outcomes and get the best decisions and get the best advancements because we're able to feed off of each other's knowledge in different areas.
UAB is an incredibly fast-paced, busy hospital with an incredible amount of volume, and our residents benefit from that quite a bit in terms of the breadth of what they're able to see and the complexity of the operations they perform. As a quaternary center, UAB offers the ability to do operations that are rarely done at other hospitals. We do cutting-edge surgery here, and I think it's very valuable for our residents to see that and to be part of that.
My experience at UAB has been phenomenal. The surgeons here and basically the whole staff and everybody have been really dedicated to fostering and building surgical residents into surgeons, and that's evident at every level. So it's been an incredible experience.
UAB has world-renowned researchers here that are committed to furthering the field, and it's a privilege for us to be able to work with and learn from them to grow our skills and build the foundation for an academic career in that way. We have very busy surgeons that are also involved in research, as well as folks that have made research their career. And so being able to work with both of those on a multidisciplinary team has been really useful and beneficial, and hopefully can use that knowledge to benefit our patients moving forward.
UAB has been on the research world, especially in developing left ventricular assist devices. Currently, we have one device called HeartMate 3, but there is a new trial, IDE trial for a new LVAD device, and UAB is now part of that FDA trial to compare the two devices. So we will be actively involved and engaged in any of those new devices coming to the market in order to help more and more patients.
My hopes for UAB and the future of cardiothoracic surgery is that we continue to grow, continue to be a leader in the field, both nationally and internationally, continue to develop our young surgeons and increase our overall residency. There is still a very decreasing number of overall qualified cardiac surgeons in the country as the years go by, and it's almost at a critical shortage right now. So one of my main hopes is that we continue to train the best and brightest of the residents that we can find and have them ready for the field and have them ready to provide care for the patients.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.